I'm Dr. Marc Beauchamp. First, I'd like to thank you deeply for your trust. So, I will be with you for the whole healing process. We'll be together in that. So I will give you a lot of instructions and tips in order to have a beautiful healing. Now you're back home after the surgery you had on your elbow. First thing, you have this tensor bandage on top of your elbow. This is meant to control the bleeding and to control the edema after your surgery. It should be worn for about 4 to 6 hours. So we recommend people to take it off by the end of the afternoon, maybe after dinner. To take it off is very easy. You just remove the clips or the bandage and you just unscroll it. And then underneath you will find a sticker, a band-aid, which is exactly like the one you see now. This should be left untouched for the first 14 days or 12 days. We recommend you not to remove it yourself. If it gets dirty and dry, it's okay, you leave it up. The only reason why you would change it is if it falls by itself. Then you can replace it with an elastoplast or a big band-aid. When I did the surgery, you had local anesthesia, which should last for about 2 to 6 hours, depending on the patient. So it's important to well control your pain during that period when the block is weaning. There are 2 ways to control the pain at first. The first one being the immobilization and the ice pack. The second will be the medication. In order to prevent the swelling of your arm, we recommend you to keep your elbow elevated, if possible higher up than your heart. So this way it can swell easily, and also to pump with your fingers. It will help also for swelling. So when you're lying down on a couch or in your bed, you should have a few pillows underneath to keep it higher up than your heart. In order to control the pain, one of the best ways is the blue pack. So the magic pack is in the freezer and should be applied directly on the sticker in order to control the pain. Every 2 to 4 hours for about 10 to 15 minutes for the first few days after surgery. It is important to start your medication before the local anesthesia goes away. This way you have the medication inside your body before the numbing goes away. So the first one to take would be the stronger one, which is usually Dilaudid or the equivalent morphine that people take usually by the end of the afternoon or early after dinner. It should be taken every 4 hours or 6 hours as needed. But we encourage you for the first 24 hours not to be shy to take whatever you need in order to control your pain. By the second day, or if Dilaudid is too strong, you can switch to the lower level, which would be something made of codeine or something similar to codeine that usually we couple with Tylenol. That is, we call it Amperset or Amtec, it is the same. So it should be taken every 4 to 6 hours in order to control the pain. It is to be remembered that always if you take Dilaudid or codeine, that you can add up with some Advil. That would increase the effect. We warn you not to mix the Tylenol with Amperset or Amtec since it's got Tylenol in it already. As for the pain medication, it's important to stop it as soon as possible, and we understand that it will depend from one person to another. So usually by the second, the third or the fourth day, they should be stopped, and usually Tylenol with some Advil is enough at that time. The pain medication that has been prescribed to you may have some adverse effect. One of them would be dizziness, another one would be constipation. So if you take Dilaudid, codeine or the equivalent, you might experience such symptoms. So if it causes constipation, colace or any other mild laxative that you can find over the counter at the drugstore would be enough for you. If you get any nausea, Gravol should be added. 50 milligram usually is enough every 12 hours. It is again to be remembered that if you have any morphine or codeine intake, you should not drive. The most important thing to remember is not to immerse the elbow under the water for the first 2 weeks after surgery. So please don't immerse it in the bathtub or don't immerse it in the pool. You may take a shower, no problem. It is advised not to wet the bandage for the first 3 days if possible. So wrap it with some plastic or whatever to keep it dry as much as possible. You can take a shower, no problem, but please don't direct the water directly on the bandage. For the surgery of the elbow, I do. For most people, unless I told you otherwise, it is important to mobilize yourself as soon as possible. So what does that mean, to mobilize yourself as much as possible? That means, firstly, to have a full flexion and a full extension without strength. So it is very important, as soon as you can, to do a full flexion, a full extension, and to move your fingers. There are no danger in doing that. After the elbow procedure you had, there's no danger in using both hands in a common way. So there's no danger in writing, in using a keyboard, driving a car, doing the usual things. I'd say that the only thing we do not want you to do would be to use either a impact object or to lift very heavy objects. So you should not lift things that are more than 5 pounds, let's say, after your procedure. It is extremely improbable that you would have a problem related to your heart or to your lungs after such a local procedure. In any case, if you have any breathing problems or a chest pain, it's important to call, not us, 911. For any other reasons that may worry you after the procedure, you have to know that you may call us 24 hours a day. So during the business day, you call us at the office first and we will get back on you. If it is after the hours, just feel comfortable to call us on the cell phone number that we gave you when you were discharged from the hospital. So all the instruction that we just gave you and all the tips can be found in this brochure that we gave you at the office. So please refer to it as much as you can. Of course, if there's any serious matter, any question you have that is not answered by it, you can call us anytime at the office or on the cell phone number we gave you. So it was a privilege really to be your doctor, and it will be a privilege to accompany you through your healing process. Thank you again.